Okay, so now we're going to talk about vitamins. And we have two different classifications of vitamins. We have fat-soluble and water-soluble. But before we get into a discussion of these two types of vitamins, we want to spend a little bit of time understanding what vitamins are and the role that they play in nutrition. So there are a couple of things to consider. They're organic compounds, and they're vital to life. So if we look at studies that have been done with vitamins, and they're called depletion and repletion studies, where they will strip the vitamin status of an individual or even an animal in some of these laboratory tests, they can really understand the role that each one of these vitamins plays in health, in keeping you healthy, so there's that part of it, but also structure and function. For instance, if you look at vitamin D, that has an important role to play in your absorption of calcium. So they can look at all of these different facets when they do these studies. They're also important in body functions. We're going to look at 3 vitamins in particular that are required for converting food into energy. So they really allow you to do the work of natural living and enable your body to run. Overall, vitamins are needed in very, very small amounts. And there's been a trend in probably the last, maybe 30 years in nutrition for people to take a lot of supplements. And so if you go to the supermarket or you go to the drugstore or even to the doctor's office sometimes, you're kind of inundated with all these different vitamin formulas. By and large, if you eat even an average American diet, you don't need those. There are a couple of exceptions, and we'll talk about vitamin D and why that might be an exception to this rule. And they're also non-caloric. And that's something we want to keep in mind, because if you look at a product like 5-Hour Energy, it might have about 5 or 10 calories in it, but it gives you this surge of energy. So you might be wondering, where does that come from? And it's all of the vitamins in there. And there are a couple that are generally in very, very high amounts, B6, B12, and niacin. Sometimes they put riboflavin and thiamine in there as well. But what's happening is that those B vitamins are giving you metabolic energy through the conversion of food to fuel, but also it overrides the system and gives you kind of this revved up feeling. And for some people, that's incredibly dangerous. So those products are to be used with exceptional amount of caution. Some recent studies have pointed to a couple of fatalities with energy drinks. So it's something you want to investigate and see what role it could play in your life. Now, when we look at the two classes of vitamins, I mentioned earlier that we have fat-soluble and water-soluble. And the important distinction here is really in how they're absorbed, how they act in the body, and some potential cautions with them. So when we look at the fat-soluble vitamins, there are 4 of those, and we're going to talk about those in today's presentation. They're A, D, E, and K. And these are absorbed the same way that lipids are absorbed. So if you recall, we have the short-chain fatty acids that go right into the bloodstream from the intestines. And with the larger lipid molecules, they're going to go into the lymph tissue. So kind of keep that in mind, that the process is a little bit different for fat-soluble vitamins. They travel on those lipoproteins, or the protein carriers in the blood, and they can be stored pretty easily in fat tissue. So when we look at the fat-soluble vitamins, you don't need to achieve the RDA every single day to be considered healthy. We're looking for people, even with the water-soluble ones, to achieve an adequate intake most days on average. Okay? So with vitamin D, I don't need to reach that intake every single day. There's a little bit of play there, a little bit of fluctuation. Now, because they are stored, it does bring up some concerns with toxicity. So this is where that supplement conversation that we just had a minute ago comes into play. For people taking supplements of any of the fat-soluble vitamins, there is a concern that it's going to build up to toxic levels in their body. For instance, with vitamin A, we have a lot of concerns during pregnancy, and I'll talk about those. With vitamin D, it's the most potentially toxic of all vitamins. So when you have a recommendation to take a supplement, or even if you're self-doctoring and you're going down to the pharmacy and getting a supplement, you want to pay particular attention to the serving size or the number of tablets to take every day. So if it says take one, and that's enough. I guess, one of the things that we run into is that sometimes people will say, well, if 1 is good for me, 5 or 6 is better, I'm going to be super healthy. Not true. You can reach these toxic levels and see some side effects, especially with the fat-soluble, but also with the water-soluble ones as well. Now, I told you that the fat-soluble vitamins are absorbed the same way that we absorb lipids, and that it goes through the lymph tissue. That's in contrast to what happens with the water-soluble ones. Those go right into the bloodstream. Very efficient, very simple absorption. And they travel freely around the body, and it's very easy for different tissues to take what they need. And these are not stored in any significant amount. So if you're taking a supplement, maybe a couple of hours later you notice that your urine is a bright yellow. That's all of the extra vitamins that your body doesn't need. So, you have this risk of having really expensive urine because you're getting rid of all that stuff you don't need. And that fluorescent color, just in case you were curious, that you see in the urine is riboflavin because it's a fluorescent vitamin. And these really, because they're not stored, the risk of toxicity is particularly low. We don't have a lot of concern around that. However, it is possible to make yourself very, very sick from taking a lot of water-soluble vitamins. Even something like vitamin C, we often think, oh, I've got a little bit of a cold coming on, I'm going to take some extra vitamin C tablets. You could end up with a lot of GI distress, so upset stomach, vomiting, diarrhea, all of these things. And with some of the other water-soluble vitamins, the consequences can be a little bit more severe. They tend to be very short-lived, but still there is that risk of making yourself sick. So those are the big differences between the two classes of vitamins. We want to move into looking at the fat-soluble vitamins in particular. So when we think about these, we have to keep in mind that they're going to be in foods that contain fat. There is an exception to that, which I'll talk about, which is vitamin A. But generally, they're very, very plentiful in any foods that have oils in them or are oily in nature. So it could be dairy products, it could be meats or fish or nuts, things like this. They require bile for absorption, just like lipids do. That bile is made in the liver and stored in the gallbladder, just to kind of refresh your memory of those particular functions. And a lot of these fat-soluble vitamins are stored in the liver. So you'll see this being true not only of humans, but also of animals, cats or dogs or polar bears or whatever it is. And it's really nice to have that reservoir. It's a little guarantee for your body in times when we may not have had access, or our diet might not be sufficient in these. It's that little reservoir to call on in case there's change in the diet. And your book mentions that you can survive weeks with that storage. A lot of research is pointing to you being able to survive much, much longer than a few weeks based on the storage. So if your diet is average or adequate in the fat-soluble vitamins and you were to have a change, an abrupt change in your diet, you would certainly be able to go more than a few weeks based on the storage in your liver. And there are still some concerns with deficiency, though. So we see people that are having a diet that is particularly low in fat-soluble vitamins being at risk. Also folks with malabsorption diseases or short bowel syndrome or something like this. Cystic fibrosis might come to mind for you as being a concern. So those individuals have to be particularly vigilant about their fat-soluble vitamins. Also extraordinarily low-fat or fat-free diets. And hopefully after our conversation about lipids, you understand that fat is a required nutrient and we need to have it in our diet. But there are still individuals out there who haven't taken nutrition class and don't understand that they need to have fat. So we see people putting themselves at risk if they're consuming a fat-free diet. That's not a healthy choice. So let's talk about vitamin A in particular. And I want to just talk about this nice feature of your textbook. They have these wonderful charts in the book. There are two different types, one that looks like this with lots of pictures. So if you're a visual learner, this can be a very good resource for you. Also toward the end of the chapter, there's a section where it's a little bit more text heavy without the pictures, but they're all listed together, all of the vitamins. These are more in order, according to the textbook with each vitamin. But use these as a resource when you're studying because they're going to talk about the amount that your body needs for men and for women. And the recommended intakes that you see on these particular little charts are for an adult, man or woman. Okay, so children are going to be a little different. Folks that are significantly older are going to be a little bit different, but generally this is going to meet most people's needs. I don't require you to memorize these adequate intakes or the DRIs. because I think that's lookup information. It's not the kind of thing that I would expect you to draw out of your head. There are a few that it would be really important for you to know, and I'll point those out as we go. But generally speaking, I'm much more interested in you understanding what the particular vitamin does in your body and any risks in terms of toxicity and what happens when we don't have enough. And food sources as well, because this is going to enable you, or if you're talking to a patient or a family member or a friend, to give some really valuable advice. I mentioned a few minutes ago that fat-soluble vitamins are found very easily in foods that contain fat. And vitamin A is somewhat of an exception to that, because if you look at some of the foods here, you don't think of carrots as being particularly rich in fats. So the form of vitamin A that we're finding in the vegetables on this chart, so the spinach and the carrots and the bok choy, is beta-carotene. It's a precursor to vitamin A. So when I eat those carrots, my body does a little chemical shift with the beta-carotene and turns it into active vitamin A that my body can then use. So these are all perfectly excellent sources of vitamin A. It's just a slightly different form of vitamin A that we're getting in the diet when we consume vegetables. When we're consuming something like a glass of milk or some butter or any of these other more fat-rich food choices, it's preformed vitamin A. And it might be, there are several different forms. It could be retinol or retinoic acid or retinal, but it's still all vitamin A, and our body can use it in that state. So when you look at vitamin A, this should not be a problem for someone who is on a particular diet plan. So maybe if they're a vegetarian or a vegan, no problem with vitamin A. And this is one that has a lot of different functions. So when we think about vitamin A, you should think immune health. This is an antioxidant vitamin. It's also implicated in vision health. So look at the different deficiencies we have. We have one called night blindness here. So people who don't have enough vitamin A in their diet, their field of vision becomes washed out if they're exposed to light in a dark environment. So at night, they aren't able to see headlights or something like this, and their eyes don't respond, the rhodopsin cells in their eyes. And it's a particularly interesting problem worldwide. Vitamin A deficiency is a significant problem in places like Nepal, other parts of Asia, Central Africa to some extent. And there are different ways the public health is dealing with this. But it also leads to more severe eye problems besides night blindness. And you should probably be aware of this. It can lead to liquefaction of the cornea. And you could Google that if you want to see some pictures. It's particularly kind of off-putting. So I don't have a slide of that. But it also leads to cataracts and blindness. Vitamin A deficiency is the #1 cause of preventable blindness worldwide. In the US, it's diabetes. And there's a lot of effort to help people get the foods that have vitamin A or to get them supplements or something like this. Now we can reach toxic levels. I've told you about some of the problems with deficiency. So I particularly like this picture, and you can probably pick out the hand of the individual that's had a little bit too much vitamin A. And so you can turn this kind of yellowish orange color, look a little bit like a carrot. It's harmless. It's considered not to be a significant problem. It's a subcutaneous toxicity, which really means that vitamin A is being stored right under the skin and the fat tissue that surrounds our body. There are a couple of different pills that you could buy early on in tanning, when we realized that tanning salons were particularly dangerous for increasing our risk of cancer. There were a couple of companies that started marketing vitamin A supplements as a natural tanning agent. And they don't seem to cause a whole lot of problem in terms of toxicity, as long as you're not pregnant, but you will turn kind of an orange color that's pretty unnatural. And sometimes children will do this, especially little toddlers or infants. They get really interested in particular foods and they go on a food jag and they might have carrots or sweet potatoes, and moms get really concerned when Junior turns a little bit orange. It's considered pretty harmless. But when a woman is pregnant, you have to be very, very vigilant about vitamin A. A prenatal vitamin has just the right amount, even if she's consuming a lot of other sources of vitamin A in her diet. We really want to avoid megadoses of vitamin A during pregnancy because it's associated with different kinds of physical deformities in the fetus. So again, a lot of concern there, and that would be one of the toxicities that I'd want you to be familiar with. Let's move on to vitamin D. And if you've been paying attention to the newspaper, magazines, or any kind of media, you'll notice that there's been a big conversation about vitamin D in the last probably 10 years, especially in the Northeast, because one of our significant sources of vitamin D is the sun. There are very few food sources of vitamin D that are acceptable to every single population in the U.S. So we're going to kind of keep that in mind. We're going to come back to why vitamin D is a problem in the Northeast. But let's look at some of those food sources. So if we think about milk, that's been fortified. Milk naturally doesn't have vitamin D. So if you're consuming raw milk from the farm down the road or something like that, it might be an okay choice, but I would have a lot of concern if people are feeding that to young children and they don't have another source of vitamin D. There is some evidence in the U.S. that children's bone mineralization is lower than it should be, and it's attributed to a lack of vitamin D. You also see seafood products having vitamin D, and we don't eat enough fish in the U.S. for various reasons, environmental contaminants, cost, accessibility, different issues like that. So the chances that you can meet your vitamin D requirement just based on seafood is pretty low. Eggs also have some, and mushrooms have a little bit. But you'd have to eat copious amounts of mushrooms every single day. So if you just throw a few mushrooms on your salad and think, oh, I'm good with vitamin D, that's not going to be enough. So that's why fortified dairy products are an important source, especially for kids, because they're getting vitamin D and calcium. And we have to have that vitamin D in order to absorb the calcium. Years ago, when we were really concerned about osteoporosis, which is a weakening of bones as we age, a lot of doctors would tell their patients, here, take a calcium supplement. And it was completely ineffective because you have to have the vitamin D. So that's one of the chief functions that I want you to be familiar with vitamin D. It helps you absorb calcium from the diet. And it also regulates blood levels of calcium. Calcium is an important electrolyte, and it functions in a lot of different ways in the body. There's significant research going on right now at research universities all over the U.S. and even internationally, looking at the important role that it plays as a hormone. Almost every single cell on your body has a vitamin D receptor, so we're just starting to understand what it really does. But we know it's implicated in reproduction, in cell proliferation, some cancer development. And this is all preliminary, so we don't really understand how this all fits together. So when we look at those roles, it helps us to kind of understand what's going to happen with deficiency. So if you remember that it's involved in bone health and you don't have enough of it, then we see some abnormalities in skeletal tissues. With children, we call this rickets, and this might be something if you've read Dickens or some of this literature, you might be familiar with rickets and bowed legs in children, especially in industrialized London. So if you think about that historically, there's no vitamin D added to milk, and the sky is filled with all kinds of smoke, so there's not going to be any sunlight filtering down to children on the ground. As well, when you think about the latitude of London, they're not going to be getting sufficient sunlight during the winter months. So you saw a lot of kids really facing lifelong skeletal deformities based on a lack of vitamin D. So in children, we call this rickets. Okay, and I'll show you a picture of this and you'll understand how this kind of manifests and looks. And it's not just in long bones like the legs, but I'll show you a picture where you can see some other telltale signs of rickets. In adults, because their skeleton is fully formed, you're not going to see the bowing of their legs, you're not going to see this particular presentation. Instead, you see something called osteomalacia. And this is really about under-mineralized bones. So if you think about bones as being two important tissues, so we have proteins and then mineral tissue. And if you don't have enough minerals, what happens is that you have kind of this distortion and have more protein. And that really allows the bones to bend and become softer. The risk factors for this are people who don't have enough vitamin D, people who don't have enough sun, and it can also be related to a whole bunch of pregnancies with a short interval between them. So when a woman has less than about 2 years between pregnancies, or if she's having extended periods of lactation, you can see that her mineralization of the bones and teeth is going to decline a little bit. So we really want women to continue to take a prenatal vitamin and have a very good diet, not only in pregnancy, but then afterwards while they're nursing. So I told you I would show you a couple of pictures of how rickets looks. And you can see in this toddler, you can see these long bones here have started to bend. And it really starts to happen as soon as the child can bear weight or within a short time afterwards, because there isn't that strength. And when you start to put weight on the bones, because that protein is soft and wants to bend, you get a curving. So it kind of looks like cowboy legs or something like this. And then over with this child, you can see it's a little bit faint, so you have to really know to look for it, but you can see a line here that runs kind of from the nipple out to the side here. We call this ricketic rosary. And what we're really looking at here is a little, almost like a little bump or a knob on those rib bones, and it's just this presentation here. You can also see some different kinds of issues in this particular graphic. So you see again that the bones are going to be a little bit curved. You can see this ricketic rosary, and there are a couple of other little signs. But generally, these other two that I've mentioned are the telltale signs the doctors are going to look for. This isn't something that occurs very commonly in the U.S., although about 3 years ago there was a case reported in Springfield. And it's just parents who maybe aren't aware of an appropriate diet for the child, or some children don't like milk, or there's so many other issues. So if a child doesn't drink milk, which is the #1 source of calcium and vitamin D, we need to find some other substitute. It could be soy milk, it could be a hypoallergenic formula, it could even be a supplement if it comes down to that. But when children are growing and their skeleton is forming, it's critical that they get vitamin D and calcium. Now, it is possible to get too much. And this is something we also see. There can be different kinds of reasons why this might happen. A biochemical imbalance with parathyroid gland sometimes causes it. And I'm not going to go into that. You could look it up if you were interested. But what I want to kind of talk about with toxicity is that we see that if there's too much calcium, which is a result of vitamin D, really, you see this relationship, that calcium has to go somewhere. So we can see depositions of calcium. We can also see issues directly related to that intake of vitamin D. So again, a lot of GI distress, appetite loss, which we would call in a clinical sense anorexia, and thirst, and you can see some issues related to mental health and emotional health. But let me tell you, if you went to the doctor and said, I'm not feeling very good, I've got an upset tummy, and I'm feeling a little bit depressed, the doctor is not going to immediately say, oh, I bet that's related to vitamin D. This highlights the importance of actually disclosing to your physician or encouraging patients to disclose any supplements they're taking. Even if they think it has no effect on whatever's going on in their life, the doctor needs to know all of these things because it allows us to really understand what's going on with individuals. All right, I told you that sun is a #1 source for people who aren't drinking milk, or maybe I didn't, but I want you to get that message. There are some reasons why people have trouble making vitamin D from the sun, especially in the Northeast. So one of the standards of care that's changed recently is that rather than having doctors actually measure vitamin D status in their patients, if they are living in an area north of Philadelphia in the winter, instead just to give them a vitamin D supplement, is because we can't make vitamin D from the sun at our particular latitude. Those are the lines that run horizontally around the globe in the winter. So from about October until April or May, you can't make vitamin D from the sun. Even if you're out there in your bikini, you're not going to be able to. The sun's rays aren't at an appropriate wavelength. There are other issues besides that. So skin color, so the natural pigment of your skin. Fair people tend to make vitamin D much more rapidly from the sun. So people who are darker, it's going to take a longer sun exposure. Air pollution, city living, clothing. So if you think about somewhere like the Middle East, you think, oh, tons of sun there in Saudi Arabia or Yemen or all of these countries. but you actually see incredibly low levels of vitamin D and potentially a lot of cases of under-mineralized bones. And it's because women there and men wear robes culturally. So you have to be really aware of clothing. So in the winter, you know, obviously we're not going to be able to make it outside even if we are exposing a lot of skin. But in the summer, you want to be aware of that too. It's okay to go outside in the sun, you know, for 5 or 10 minutes. We never want anyone to burn, right? That's absolutely a bad idea. But it's okay to be in the sun for a few minutes. And a lot of doctors are starting to encourage their patients to actually go out and get some sun, you know, and we need them to show their arms and their legs. Just your hands and your face, that's not going to be significant. Geography, that kind of goes along with latitude. Indoor lifestyle. Think about teenagers, video games, computer, TV. We're really concerned about teenagers. Evidence shows that they're not getting enough vitamin D, they're not drinking enough milk, and I'm not pushing milk. They can have another source of vitamin D, but that has historically been an important one, and instead they're drinking more sodas and juices. Season, sunscreen. So SPF is a great idea. Again, we don't want to have sunburns, but well-meaning parents lather the child up with a lot of sunscreen, and we never allow the child to actually be exposed to sun. This is going to dramatically impact bone health. So again, toddlers and young adults even are showing really low bone mineralization, especially if they're using a lot of SPF. Time of day also plays into this. So it could be somebody working during the day who isn't going to be able to have exposure. Even getting out at lunchtime would be a good idea. Or someone who works at night and sleeps during the day. So you really need to be able to get outside a little bit. Let's move on to vitamin E. Again, this is another one of our antioxidant vitamins. And if you need a little trick to remember them, it's ACE, A-C-E. Those are our 3 antioxidants, and A and E are fat soluble. So let's take a look at some of the sources of vitamin E. This one really shouldn't be too much of a problem if you consider the typical American diet. It's found in a lot of different cooking oils. So it could be sunflower seed oil or safflower oil or canola oil. Really any of those are going to have some vitamin E. It's also found in nuts and seeds. So again, that's a thing that, you know, we can put on salads. You can put it into your cereal in the morning. In some of our condiments, like if you like mayonnaise, that might be an option. I also really like that it's in whole grains, because this is an opportunity to kind of meet 2 needs at once. We want 50% of the grains you eat every day to be whole grains. So if you're eating whole wheat or some other whole grains, kind of in the wheat family, you're going to be able to get some vitamin E there. And if you aren't familiar with wheat germ, it's you know, something that you can stir easily into your breakfast cereal, into yogurt. They sell it toasted or raw. I put it in chocolate chip cookies at my house. And it's a way for me to boost the nutritional value of that food. I told you that vitamin E is an antioxidant. It has some other functions that are particularly important to us that we want to talk about. So I mentioned that it's an antioxidant, but a lot of people are familiar with that word but really don't understand what it means. When you think about an antioxidant, what it does is it's kind of like a little policeman to some extent. And it's going to circulate around the body and turn off the potential of some other chemicals in the body to do cellular damage. We call those little potentially damaging particles free radicals. And they happen for lots of reasons. You're exposed to free radicals from the environment, from the sun, for instance, chemicals. They're also a product of metabolism and just the breakdown of food. So for instance, trans fats produce free radicals. So vitamin E has this important role to play as that policeman and kind of protecting cells from any damage. But when we take extra vitamin E, it doesn't seem to have any health benefits. What's important here is to get vitamin E from food sources. Most people do okay. They're generally achieving about 60% of the RDA, and for men and women that's 15 milligrams a day. So most people are around 10 or so, but we could do a lot better. One of the reasons that people are a little bit low in vitamin E sometimes is that it's particularly sensitive to food processing or heating. So when we're cooking foods, we lose a little bit. You tend to lose vitamins during the cooking process, not minerals. Minerals are going to stay intact. This is an important kind of note to make to yourself when you're cooking, that you don't want to overcook foods. Cook them till they're done, and that's enough. You might even consider eating some things raw. So instead of always having roasted sunflower seeds, maybe have some raw, or eating some of these other kinds of fruits and vegetables that are in a raw form. Cooked is good too, you want to have a mix. We also see people having just a kind of chronically low intake of some of these things. So, we see people that maybe they're getting some from fried foods, maybe they're having foods that are cooked in canola oil, but really that isn't the end of the story. We want them to be, an additional source in people's diet. Okay? So let's look at what happens with deficiency in vitamin E. I mentioned that low intake is pretty common, and we are able to store it, and cells recycle it. So these are all good things. But one of the potential issues that you see with deficiency is anemia. About 20% of your body's store of vitamin E is found in red blood cells. If we don't have enough vitamin E, what happens is that those red blood cells become much more susceptible to damage, and they break at a much higher rate. And when you're breaking these red blood cells, the count goes down, and you see potential for anemia increasing. We also see some different kinds of symptoms appearing with folks that are a little bit low in vitamin E or deficient. So you have some issues with movement and muscle coordination, also vision and speech, which are also really, if you think about it, muscle contraction. We also have some issues with toxicity with this. Years ago, there were several studies being conducted looking at what happened when we had extra levels of vitamin E in our diet. So going beyond that 15 milligrams a day and giving these particular study participants much greater amounts. And we saw that there were some interactions with particular medications that are commonly used in the US, so blood thinning medications. So you might think about warfarin or Coumadin, and vitamin E can interact with that. And it starts to actually affect the ability of those medications to do their job. So we don't want people to not choose vitamin E foods. Instead, if you're on one of those medications, you want to have a consistent intake every day. So not that one day you would sit down and have a lot of vitamin E and then the next day none, because you're going to be on this roller coaster of efficacy with those medications. Instead, consistent intake and talking to the doctor about your diet. Let's move on to vitamin K. And with vitamin K, one of the things you'll notice with this is that it's found in a lot of leafy green vegetables, also in cauliflower. So those are really good sources, things like asparagus and broccoli as well, also in soybeans. So this should not be a problem for most Americans if you're on a vegan diet or any kind of special diet. Vitamin K is not really an issue for you. Vitamin K has a little bit of an interesting history. I've always loved this, that vitamin K is named after the word coagulation in Danish. Maybe you'll notice that in the book. So if you can remember that, it's going to help you understand some of the functions. This one is critical for allowing your blood to clot. So now don't confuse this with hemophilia. That's something completely different. That's a genetic disorder where people's blood doesn't clot. But vitamin K, that particular chemical in the body, allows this clotting cascade. So if we don't have it, we're going to increase our bleeding time. And it can also, just like vitamin E, interfere with some of those blood medications that people might be on. So again, we don't want patients to have no vitamin K in their diet and avoid all those wonderful green leafy vegetables. Instead, it's about consistent intake. And there's a lot of movement in most hospital settings or with most doctors that when they put an individual on those medications, there's a lot of educational material that comes along with that. We want people to pay attention to that. There is a little bit of evidence that the vitamin K can be really important in terms of bone health, especially as we age. So it's not just about blood clotting, but also ensuring proper bone formation and making sure that your bones throughout the year stay healthy. Because your bones are continually remodeled, we call it. So we're recycling some of those bone cells and strengthening them and replacing them. And it's about 10% of your skeleton every year. So if you think about that, every decade, you've kind of got a new skeleton. This highlights the importance of having a good diet throughout the entire life stage. So not just when we're kids, but also when we're young adults, and then into our aging years. There are a couple of other sources. Now we've talked about green leafy vegetables, and I put that on this slide. where you can kind of take a look at the amount that might be in some cooked spinach. And then also things like lettuce. And I'll just have a note about lettuce here that iceberg, don't really consider that lettuce. I think it's more like crunchy water. Instead, go for something that's actually green if you can. If you need to kind of have a gateway lettuce, romaine would be a good choice. Still crunchy and similar to the iceberg, but has a lot more nutritional value. And see if you can move into green, really green leafy things. Another source for us is intestinal bacteria. So you have all of this natural bacteria in your gut, and they're able to produce vitamin K for you through their normal metabolism of different kinds of products that make their way through the intestines. They're going to make vitamin K, and it's just there for us to absorb, which is great. Fortified cereals are also an important source. And when you look at the diets of children, fortified cereals provide the vast majority of the micronutrients they need. Which that's good, but it also gives us an opportunity actually to increase some other foods that would be beneficial to children. If you look at eggs and milk, about 25 micrograms there. So again, for someone that's consuming an average diet in the US with even an average amount of variety, vitamin K should not be an issue. Very, very rarely do we see deficiency of vitamin K, but there are a couple of reasons why this occurs. So if we look at individuals who are eating an average diet, even if it's not full of those vitamin K rich foods, they're probably going to be okay because of intestinal bacteria. There are a few risk groups that we want to consider. So newborns are a big one. And so if you've had a baby or know someone that has, you could talk to them about this, because one of the first things they do after the baby is born, also their vaccinations, they do a little heel stick for PKU, but they're likely to give them a vitamin K shot. And the reason that they do this is that there's low placental transfer, which means that the vitamin K in the mother's body is not going to make its way across the placenta into the baby. Okay? Even if she's well nourished in vitamin K and eats lots of those vitamin K rich foods, it just doesn't happen. Also, the content of breast milk is pretty low, so the baby is not going to be getting it there either. Formula does tend to contain vitamin K. Also, if we look at the baby has a sterile gut, and what I mean by this is that the gut of that newborn hasn't been colonized by bacteria yet. It takes about 2 weeks. So during that 2 weeks from birth up until the colonization of the gut, there is potential for there to be some catastrophic consequences of vitamin K deficiency in the infant. So if the infant were to suffer some kind of an injury or have to have surgery or something like this, which is also, it's a very rare occurrence, but it's still, the risk is there. We can dramatically decrease that risk by giving a vitamin K shot. Our other big risk group are people that are on long-term antibiotic therapy. And I know that around here, people will talk about being on antibiotics for maybe 6 months or something if they have Lyme disease. This is my target population for a conversation about vitamin K, because that antibiotic is going to kill some of that natural bacteria in your gut. One way that we can kind of override that a little bit is for someone to take active culture yogurt while they're on the antibiotics, and that's always a good idea. But sometimes you need to actually be a little bit more proactive. So if somebody's on antibiotics, it might be necessary to have that conversation with a physician, even a dietitian, to say, how can I make sure I'm getting enough vitamin K? People that have low bile production also. And this is, again, kind of a rare occurrence. Even if you've had your gallbladder out, this doesn't affect you because the gallbladder is only that storage site. It isn't actually producing bile. So keep that in mind, that there's going to be a low risk group. And what happens with that kind of low level of bile is that it's not sufficient to help you absorb some of the vitamin K from fat-rich foods. Okay, so those are our 4 fat-soluble vitamins, A, D, E, and K. And now we're going to talk about the water-soluble ones in the next video.